Good evening. Good evening. My name is Brian Dorries. I'm the Artistic Director of Theater of War Productions. We're so thrilled you could be here with us tonight for the 5th installment of our long-form journalism series and radio show here at WNYC. Every time we do this, we kind of experiment in different ways. We've been, over the span of the last 5 episodes, trying to bring more and more of the live sound into the recorded version of the radio show that will air a few weeks from now on WNYC. So I hope you'll bear with me because I'm going to have to wear a couple of different hats while working with you all tonight. But basically, the structure of the event is really simple. The actors who I'm about to introduce in just a second are going to come out. They're going to read an article by Rebecca Nagle from The Atlantic. We're really grateful to The Atlantic for letting us read this beautiful article about long COVID and its lasting impact on communities and individuals today. And then as soon as the actors are done, they're going to go sit in the audience. I'm going to come out here and ask questions of you. In our model, we believe the audience was something at stake. And since 1 in 20 Americans have gotten long COVID, that's everyone. The audience with something at stake has more to teach us than we to teach you. And we're interested in the wisdom that's in every crowd and also the multiplicity of perspectives in every crowd. This is going to be a conversation both here in New York City, but also on Zoom with more than 1,000 people signed up, with people all over the country and the world, and we're going to bring them on the screens into dialogue with you here in the space, and then we'll distill it all into a 51-minute radio program from the 90 minutes we're going to spend together tonight. So that's just how it's going to work. I wanted to give you those before just kind of going back to my little table over here to read my intro. I want you to know that you're part of the experiment as our studio audience, and so when you applaud, when the actors come out, I ask you to do it like it's the Tonight Show or it's Citi Field, and really give it for them, so the people listening in their cars have that feeling of being in the room, and the folks on Zoom, you get to watch us with transparency, this whole process. And then during the discussion, when I start asking questions, I encourage you to answer from your hearts and your guts, not what prepared remarks, but what you're thinking in the moment, what you're feeling in the moment in response to what's being said. Maybe you won't have your words, or maybe your words come to you later and you say them later. But if you hear something that someone says in the room that really speaks to you, feel free to speak to them too. Sometimes in our model, it's like a lot of testifying, and that's okay because we are listening to each other as we answer the questions. But sometimes the most electrifying moments are when someone says, I heard what you said, and it prompted me to say this. And I was really touched when you, sir, said this because it spoke to me in these ways. So feel free to do that during a discussion because that really translates to the radio as well. So without further ado, I'm going to go back to my little table and my setup, and bear with me as I deliver these opening remarks. And then as soon as I'm done, the actor's going to come out. We're going to get down to business with our reading, and then we're going to get to the most important part of the event for those of you here in New York City and those watching on Zoom, which is our discussion, which is the main event where people take the risk of being present with each other and with their thoughts before their words have even come to them, and respond to each other in real time, and to this article by Rebecca Nagle. So without further ado, just bear with me 1 second. This will get smoother every time we do it, but this is the first time I'm using headphones, so I can actually hear myself. All right. And people will mess up. I might mess up. We might retrack. You're part of this process with us too, but we're after the live event. You don't have to retract yourself. If you mess up, just keep going. I'm Brian Dorries, Artistic Director of Theater of War Productions, where we perform powerful texts for audiences with something at stake, and then pass the mic to anyone who comes to listen, to start a conversation and foster dialogue that reflects the many perspectives in the room, the wisdom in every audience. Today, we're coming to you from WNYC in New York. Today, we're coming to you from WNYC in New York, and we have many others joining us from all over the country on Zoom. Together, we'll listen to a story written by Rebecca Nagle, a citizen of the Cherokee Nation, who currently lives in Oklahoma. Rebecca's article describes her experiences with long COVID and the Indian Health Service, the federal program that serves Native communities across the country. During the course of her reporting, she interviewed dozens of people who are living with long COVID in big cities, in rural places, all across America. During the course of her reporting, she interviewed dozens of people who are living with long COVID in big cities and rural places all across America. Many of them are still struggling to find the treatment. Many of them are still struggling to find treatment within their own communities. The actors who'll be reading the piece are Gary Farmer from Dead Man, Irma-Estel Laguerre from Black Panther, Wakanda Forever, Tanis Parenteau from Billions, and Lou Diamond Phillips from La Bamba. Please welcome them to the stage.
My house was dark. Tin foil covered the windows. The only light I could tolerate came from dimmable red bulbs.
2 weeks before, I had tested positive for COVID.
On week 3 of my infection, I went to the emergency room with a debilitating migraine.
On my 3rd trip to the ER, I was hospitalized for 7 days. I came home to a changed life.
All the cliches about headaches are true. A pile of bricks on the head, a vice grip on the temples, an axe through the skull.
The pain altered my consciousness.
Trying to move or access a thought was like trying to see past a flashlight shining in my eyes.
It was 2024, a point at which most people in America considered the pandemic long since over. But it wasn't for me.
Some days I couldn't stop crying. It was more than despair at my circumstance.
Long COVID can dysregulate mood and has been linked with depression.
And the disease hijacked my stress response system, leaving my body in a constant state of alarm.
Any unexpected sound, even getting a text message, would set off a jolt of panic through my body, the same sensation as slamming on the brakes while driving.
I lost my ability to cope.
I broke a window in my house.
I put a hole in the wall.
Researchers know more about long COVID than they once did, but it is still hard to define. The clearest consensus is that it's a complex collection of symptoms that can affect almost every organ system in the body.
Theories of why COVID can linger abound and include ongoing inflammation, the virus never fully going away, and tissue damage. Many scientists agree that multiple factors likely contribute.
Meanwhile, doctors are still struggling to treat the disease. Less than half of doctors know how to diagnose long COVID, and even fewer, 28%, report knowing how to treat it, according to one 2023 survey.
Long COVID patients are still reporting that medical professionals don't believe them. And though in some cases, patient self-diagnosis might be off the mark, the reality is that many people living with long COVID simply aren't getting the care they need.
In my case, that person who is in mind-numbing pain, unable to read, unable to write, unable to Google things or look at screens, unable to drive, drained by talking on the phone, spiraling in despair, and barely able to leave the house, had to navigate the American healthcare system.
That I needed care for long COVID only made my predicament worse.
From hearing chronically ill and disabled people speak about their experiences, I knew that to be sick in this country is a hell unto itself. But knowing something is true and experiencing it are different.
I know that the Grand Canyon is deep, but I have never seen it with my own eyes. For our healthcare system, I have been to the bottom.
According to the latest federal survey as of September 2024, more than 1 in 20 adults in the United States had long COVID, defined as symptoms that last longer than 3 months. The survey does not ask about the severity of symptoms.
Vaccines may help protect against the disease, but getting COVID still means risking long COVID. The coronavirus can leave patients with blood clots, brain dysfunction, organ damage, immune problems, and more. About a quarter of people with the disease report that it significantly disrupts their ability to perform daily activities.
There are no FDA-approved medications to treat long COVID. Many medical institutions created specialty clinics to see patients with the disease, but much of what even the best clinics can offer is symptom management.
Pinning down recovery rates from long COVID has been difficult. But according to several studies, after 2 years, the majority of people living with long COVID had not fully recovered.
3 months into my illness, I had been treated for migraines and a concussion. COVID's impact can mirror a traumatic brain injury, but not long COVID.
The tribe that I belong to, Cherokee Nation, runs the largest outpatient facility of any tribe in the U.S. But my primary care provider there told me she didn't know how to treat long COVID.
I was referred to my tribe's specialty clinic for rare and infectious diseases. When I managed to get that appointment, however, the provider told me he knew how to treat only pulmonary long COVID symptoms, which many long COVID patients don't have.
Nowhere in Indian Health Services, the treaty-based federal program that serves 2.8 million Native Americans nationwide, is there a long COVID clinic. An IHS spokesperson said the Biden administration would have needed to set up such a clinic.
I started looking outside Indian Health Services and found a long COVID clinic an hour's drive from my house. When I called, I learned the clinic had shut down.
The state where I live, Oklahoma, does not have a long COVID clinic. My dad found one in Arkansas. Like many long COVID clinics, it required that patients apply to get in. But after I submitted all the paperwork, I didn't hear back.
I realized that to access care, I would need to travel. At the time, I was unable to drive, and my symptoms limited how much time I spent outside my house.
When I called the Cleveland Clinic, I was transferred 4 times until I was accidentally forwarded to the customer satisfaction survey. I spoke with one receptionist who told me her clinic didn't take patients from out of state, and another who warned that traveling to her clinic probably wouldn't be worth the time and money.
A spokesperson for the Cleveland Clinic wrote that patients should be able to make an appointment without a referral, and that the clinic and its staff strive to provide patients with timely access to scheduling and care.
In my first telehealth appointment with a nationally recognized COVID clinic, the doctor wouldn't discuss her recommendations, but said I could read them in the patient visit notes. When I explained that my symptoms made reading impossible, she asked me if someone could read the notes for me.
Later, my mom read me a copied and pasted list of healthy lifestyle information, such as the benefits of taking daily probiotic and the importance of getting enough sleep. The list included the doctor's favorite bedtime tea.
I told my mom to stop reading.
That was the first part of Rebecca Nagle's piece from The Atlantic. We're going to take a short break, and then we'll hear the rest of the story before our audience responds. I'm Brian Dories, and this is Theater of War Productions, presented by WNYC. Back in a bit. I'm Brian Dories, and you're listening to Theater of War Productions, presented by WNYC. Our series invites people to respond to journalism live in real time. We've just heard actors perform the first part of an article from The Atlantic. It's a story about long COVID and what it's like to navigate the disease within the Indian Health Service. It was written by Rebecca Nagle, who had firsthand experience of this. Rebecca is Cherokee. She tested positive for COVID in 2024, long after many people considered the pandemic to be over. Debilitating headaches and emergency room visits followed. Next up is the second part of Rebecca's article from The Atlantic. We'll listen, and then we'll talk about it. We're joined here by a live audience in New York and hundreds of people all over the world who are tuning in via Zoom. Here's actor Lou Diamond Phillips with the second half of Rebecca Nagle's piece.
A few months into the pandemic, some patients reported that their symptoms weren't going away. Through their advocacy, long COVID got its name.
By 2022, hundreds of long COVID clinics had opened across the country. There is no standard for what kind of care these clinics provide.
Some are multidisciplinary teams, but many are one specialist or one nurse practitioner. This patchwork system of care has only deteriorated as attention on the disease has dwindled.
Many of the long COVID clinics that popped up during the pandemic have closed. As part of my reporting for this story, I compiled a list of 171 clinics drawing from the Survivor Corps website, a patient-led resource and advocacy group, and from searching online for long COVID clinics by state.
I then called each clinic to verify which ones were still operating. Of those, 79 were still open and accepting new patients. 5 were not accepting new patients or outside referrals. 61 had closed, and 15 were unreachable after 2 attempts. 11 more were advertised as long COVID clinics, but don't have a medical doctor or a nurse on staff. They provide services such as speech or occupational therapy.
My assistant, Sydney Anderson, and intern Cheyenne McNeil, who have been helping me work through my illness, contributed to this reporting.
Based on the list we assembled, 22 states no longer have COVID clinics accepting new patients. Given COVID rates in those states, we estimated that almost 3 million people who currently have long COVID reside there.
Because of insurance policies, licensing and telehealth laws, and the cost of travel, not having a nearby clinic can easily mean that patients won't access care. Of the long COVID clinics that are still open, some have wait lists, do not accept outside referrals, do not take insurance, treat only specific long COVID symptoms, or do not take patients from outside of their geographical area.
Getting in touch with the long COVID clinics that are still open is another barrier. I spoke with operators who had never heard of their institution's long COVID clinic. I got transferred to the office that schedules COVID tests. I got transferred to disconnected lines. I called numbers that rang and rang and rang and rang.
One day, I spent 2 hours on the phone and spoke with only 3 people who could provide information.
When I called Yale New Haven Health Systems Clinic, one of the most well-known in the country, I got transferred to a disconnected line.
I called back and got transferred to the customer satisfaction survey.
I called a third time and left a message.
I called a 4th time, trying a different number, and spoke with a receptionist who said the clinic was closed.
The clinic is still open. In a statement, Yale New Haven Health said that the phone number for the long COVID clinic is on its website, that the volume of calls the clinic receives is very high, and that it had not previously heard of patients having difficulty accessing the clinic.
If you are healthy, this might all sound like the familiar nightmare of customer service to which we are all familiar with.
But for people who are sick, it is a wall that stands between them and the care they need. When you are sick, you look at that wall and think, I am not well enough to climb it.
The closure of long COVID clinics in recent years has affected patients who need care. I talked with people who, like me, have been living with long COVID later in the pandemic.
Ryan Parker lives in Portland, Oregon, is a member of the Northern Cheyenne tribe, and used to work in philanthropy. Like many people with long COVID, Parker tried to work through his illness. He told me he returned from one work trip so sick that he couldn't get out of bed for a month. Last fall, the long COVID clinic that was treating him closed.
Because of the disease, Maeve Sherry has been disabled and unable to work for 3 years. They found a long COVID clinic in Great Falls, Montana, 3 hours from where they lived at the time. But it closed in December of 2023. They said, there are now no long COVID clinics in Montana.
When Maisha Hill was still struggling to do household chores, take care of her kids, and even talk weeks after a COVID infection, she looked up the long COVID clinic near where she lives in Las Vegas, she told me. But it too had closed. There are now no long COVID clinics in Nevada.
A spokesperson for the University Medical Center of Southern Nevada wrote that the clinic closed amid low demand. Other clinics echoed this response, saying they suspended operations after patient numbers dwindled.
A few clinics also stated that they now refer long COVID patients to primary care.
Several spokespeople told me, as a reporter, that their clinics were still open. But when I called as a patient, I was told the clinic was closed.
And even when the clinics are open, patients still face barriers.
I spoke with people with long COVID who told me they couldn't access care because a clinic didn't take their insurance. Their doctor didn't send a referral, or the clinic rejected them as a patient.
The alternative to enrolling in a clinic is to try to see a regular neurologist or cardiologist, but many specialists have lengthy wait times, and long COVID patients are twice as likely as the general public to report that this is why they can't get care.
Ryan Parker, the member of the Northern Cheyenne tribe from Portland, Oregon, for instance, is trying to see a specialist for myalgic encephalomyelitis chronic fatigue syndrome, a form of debilitating fatigue that is common with long COVID. The first available appointment is 9 months out.
And when patients are finally seen, the care itself might not be competent. Parker's primary care provider suggested that his debilitating fatigue was a product of anxiety.
Several doctors have also told Kelly Ryder that her problem was just anxiety, and one said it was perimenopause.
Sometimes doctors prescribe things that exacerbate symptoms, such as exercise for chronic fatigue.
When Zane Hunding's doctor ordered a stress test, she explained that she was unable to run. He didn't believe her. At the stress test, she almost fainted.
8 months into my illness, I boarded a plane and traveled with my mother to Rochester, Minnesota. The long COVID clinic I finally got into was Mayo. The off-label medication they prescribed didn't do much, but I learned about my illness and how to manage my symptoms, which has improved my quality of life.
Other things have helped too. Thanks to an arsenal of migraine treatments, my headache, although not gone, is less severe.
Thanks to 8 months of vision therapy, I can now focus my eyes and am practicing reading. And in writing this article, I have gotten back to reporting. When I had to go through to get here, I would not wish on anyone.
The resources our system of medical care can offer to those wanting to learn about, cope with, and heal from what COVID has done to their body are beyond inadequate and are likely to get worse.
In February, the Trump administration ordered the Department of Health and Human Services to dissolve its advisory committee on long COVID.
In March, the department announced it would close its Office for Long COVID Research and Practice and began canceling grants from the National Institutes of Health for COVID studies.
Sick and disabled people have been pushed to the margins of our society for a long time. There was a moment during the pandemic when I saw our collective concern focused on the ill. Living with long COVID, I sometimes wonder where that concern went.
I feel like the wounded antelope picked off from the herd.
Everyone else has moved on, while I am stuck in my illness.
I could be angry at each individual hypocrisy, each person who preached the importance of masks only to go back to normal without me.
But I am not.
Instead, I am sad that what is more powerful than our concern for the sick
Is the indifference of our healthcare system.
That was Tanis Parenteau, Gary Farmer, Irma-Estel Laguerre, and Lou Diamond Phillips reading Rebecca Nagle's piece from The Atlantic. Let's give them all a round of applause. Now our actors are going to go sit in the audience, and as our actors are going to sit in their seats out in the audience, we're going to make a couple small adjustments on stage, and as we do that, I'm going to sort of tee up our first question that I'm going to ask you as an audience, both those of you who are in the room with us at WNYC here in New York City, and those of you watching all over the world and all over the United States on Zoom. And for those of you on Zoom, just a reminder, all you have to do is, if you're moved to speak, is press the raise your hand button at the center, bottom center of your screen, and we'll call some of you up to the screen and into dialogue with folks here in New York City. So the first question that we always ask every audience after we've heard a great group of actors like the ones we've had tonight read an incredible story like Rebecca Nagle's is, as you were listening to the story here in this space and all over the country and the world, what resonated with you as you heard it tonight? What touched you? What was true? There's a hand right over here next to you. Yeah.
What resonated with me was the disenfranchised, the lack of services, federal funding, ostracizing, just people being left out that really needed services, and that's what resonated with me.
Thank you so much. I appreciate you being first. Does anyone else want to take this question on? What resonated with you? There's a hand over there.
Hi, my name is Ariel Lublin. I have long COVID, and I really resonated with the search for healthcare. And also, I went to 3 long COVID clinics, all of which were terrible, terrible. Gave me recommendations that made me worse, did not believe I had long COVID, et cetera.
Thank you so much. Thank you for being here with us and sharing that perspective. I feel like this, at the center of Rebecca's story is there are several betrayals. And one of them, and we can talk about many of them, but one of them is the inadequacy of the care that's available for long COVID. Others are like being made to wait on phones or in clinics, or waiting to speak with doctors who don't exist, or being told that the clinic is closed after you've been waiting. But there are many other betrayals on those betrayals as well, and I appreciate you bringing some of that into the room. There's a hand, I think, if your hand comes above your shoulder, we're all over you. If that's not your hand, okay. Anyone else? What resonated with you? What touched you? What was true? Yeah.
Hi, my name is Anthony Almaguera. Great job by the actors reading it. The piece obviously resonates with a lot of us. We all lived through it. As a paramedic for the FDNY EMS, I was on the front lines dealing with it. And the thing that EMS is a marginalized community treating marginalized communities. We're not as funded and staffed like we should. We don't have the right equipment. And to piggyback on the last thing, in April, the fire department ended its COVID treatments for EMS providers. So no longer will be treated or provided for. Till this date, I have 264 members who have long COVID. I have 10 that have passed away from COVID, and numerous more that probably are not reporting symptoms because they still want to continue to work. But in the article, that end line, the antelope line, implies that there's a lion. And I'm going to challenge that by saying there's no lion. We are all the antelope. And until we realize that we are all marginalized by this, by not actually investing or caring about each one of us, the people sitting next to you, whether their political affiliation, their race, their gender, until we start to realize that we are all marginalized, we will never, ever, ever get past this. And this is going to resonate with us because look at the people in power now and what they're doing as of this morning. They're taking it away because we just want to bury things all the time and go on to the next shiny thing. But we can't do that anymore. Look at the people next to you in this room. We have to realize we are all in this together. That's the only way we're going to heal. That's the only way that the people who are helping people are going to heal. Otherwise, we're all just burnt out. And I think there's hope. And this article doesn't end with there's no hope. The article is written from a place of hope that, hey, I can express this. I can get it written. I can get an audience. I can get Theater of War to provide a space for this so you guys can hear it so that we can all realize we're in this together. We're all the antelope. And antelopes are beautiful animals. We can run fast. Let's run as a herd. That's the strength, okay? Thank you.
Thank you so much. I really appreciate all of that. It's great to hear from an EMS perspective, someone who's been on the front lines of the pandemic in the beginning and is now seeing services taken away from with the very people who served us at the height of the pandemic. Marissa, you've been waiting on Zoom for some time. We're going to go to some of our Zoom audiences, members across the country and the world. Marissa, what resonated with you? What touched you? What was true?
Yeah, so first of all, endless appreciation for Rebecca and this beautiful piece. Um, Definitely the subpar healthcare. It took me about 7 months or so of severe exhaustion, not being able to get through the day, very painful and inflamed lymph nodes, not knowing what was wrong before I was told it could be long COVID. And even when I went to the long COVID clinic, there was nothing they could do. Essentially, they said, sorry, that was about it. And I think the other thing that really resonated with me is feeling left behind. I think a lot of the disabled community, chronically ill community, long COVID community right now, we feel left behind. Like the world has gone on as if nothing happened, but it's still happening, right? And even in the room right now, I see so many folks are not masked at an event focused on long COVID, right? And so that to me, I can't access the world anymore the way that I used to. I have pre-existing conditions prior to the long COVID. But even with that, it's a whole other level at this moment. And I feel isolated. And it doesn't have to be that way, right? There's just no reason for it other than just not caring about one another. So I just hope that folks come away from this piece with a feeling like we owe so much to one another. Um, and I hope that we can keep it that way and keep it going and think about the way our actions impact other people.
Thank you so much, Marissa. Thanks for sharing part of your story and for what you brought into the room, some of the questions you've raised. Ezra, you're next. What resonated with you? What touched you? What's speaking to you tonight?
I think the thing that really resonated with me from the piece is just the amount of work it takes to be a sick person. Calling phone numbers, sending endless message to portals. As I listen in, I'm preparing my notes for an appointment with my doctor tomorrow. I have printouts with all the medications I'm taking. I have lab reports. This was already on my desk. I didn't print these out as visual aids. They're just always around me. And I live in Oakland, California. I'm, next to some of the most premier research medical institutions who I can't get seen by because I can't afford it and I don't have the assurance for it. But I live in a major metro area, and I think about all the people for whom access to healthcare is it's impossible. You can't get it. And so I think the thing that really resonated with me is just the amount of work it takes to be a sick person and the fact that the work never ends. My friends and family may have decided the pandemic is over, but unfortunately I don't have that luxury.
Thank you so much, Ezra. It's great hearing from Oakland, California. Thanks for what you brought into the room. Jesse, you're next. What resonated with you? And then we'll go to Katie after you on Zoom. We'll come back to the room. I'll ask another question. Jesse, over to you.
Hi there, everyone. Thanks so much. I'm Jessie Chafee. I live in New York. I developed long COVID in 2022 and have been sick ever since. I think that I've been fortunate to have some good experiences at long COVID clinics, and I've been fortunate because of where I live to participate in a number of clinical trials, some of which have helped. And so I see that there are medical professionals who are really working to find answers. And I also see that they're completely overwhelmed and that the demand is far more than what is available for people. I think what resonated with me most was the sense of isolation and the sense of people, all kinds of people, even people that are friends of mine, wanting to move on from the pandemic, wanting that not to be their reality anymore. And the feeling that makes those of us who remain sick invisible and negates this experience. So I really appreciated that part of the article. Thanks.
Thank you so much, Jesse. I really appreciate you coming to us via Zoom, even from our own city. And it's not lost on me that you probably can't be here with us for the reasons that have already been outlined. And this point about isolation is so powerful. The other point you make that I think is also I want to bring into the room even more is the mystery of long COVID. I mean, while there are lack of resources, while things are being shuttered and clinics are being closed, there's also the fact that we're just kind of coming up out of it. Scientists are just beginning to wrap their heads around what this is. And so there may be treatments, but there might be treatments that are far off. And what does it mean to live with a disease where treatment for the disease isn't yet developed or available on the level that it needs to be? I appreciate that. Katie, thanks for your patience. We're going to go to you, and then we'll come back to the room over here. Katie, what resonated with you?
Hi, my name's Katie Gasmy. I developed long COVID in 2020. So I was the early stage of the pandemic. And what I noticed being a daughter of a physician, it was terrifying navigating this side of healthcare, being healthy all of my life. I really took for granted the access to care. And then I thought, if it's this difficult for me, how difficult is it for those who don't have the resources? I'm in DC, I'm in Washington. And so that rang true throughout her entire piece. It was very powerful, resonated with me. But something that each and every person is touched on right now. But, from the isolation to the lack of treatment to just the wanting to leave this behind. There are millions of us who can't. And long before there was long COVID, I'm sure quite a few people have been diagnosed now with ME/CFS, and it just brings a light to another chronic illness that has been long forgotten, and there are millions missing. And this is something which we could take an opportunity to shine a light on that and to help bring these two communities together to actually bring about awareness and then, funding for research. And instead we want to bury it and try to move past it. But those that are healthy, the unfortunate part of all of this is, right now I am living with ME, and all of those that are healthy, this could be you. ME does not discriminate as long COVID doesn't. And so bearing it is not the cure. Bearing it is not going to provide all of us that are missing out on our lives the opportunity to get our life back. So this piece is extraordinarily powerful and touches on all of that for me. So I just wanted to thank the writer and all the actors who participated in reading this piece.
Thank you so much, Katie. Thank you for joining us and for bringing your story into the room and making such salient and important points. It's a great segue to my next question I'm going to ask you as an audience, so I appreciate you teeing it up. And I'll ask you here in New York, and we'll hear from some people here, and then we'll go back out to our Zoom audience a little bit as well. In the article, Rebecca talks about that time. I'm sure we all remember when collectively, maybe for a fleeting moment, maybe for a few months, all of our attention and care was placed on the well-being of the sick. And then she writes in her article, living with long COVID, I sometimes wonder where that concern went. So it's a bigger philosophical question, and I'm sure everyone here has a different answer, but where did that concern go? And are there people here possibly who work in healthcare or clinicians, other types of people too, who can tell us where it went and why? I think there's a hand over here, yeah.
Thank you. First of all, thank you so much for organizing this, and to the wonderful actors for reading this fantastic article. Thank you also to everybody here who chose to mask. I appreciate that in a mask-encouraged context that you chose care for your community and for yourself. To answer that question, I think what we had and what we still continue to experience is a sort of form of trauma and PTSD from the pandemic in that context. That what we all sort of experienced in 2020, not just with COVID, but with the broader upheavals that we experience across the world, was similar to what we might experience in an interpersonal context with, say, a partner, where you encounter an existential experience in which you discover that your partner in that moment of existential need does not have your back, that there really is no solidarity there. And then from moment to the next, the existential event passes, by fiat, so to speak. And then you still have to live in that relationship with the knowledge that that they're not there for you in that sense. And so I think living with that has been really difficult for a lot of people, both living with long COVID or myself as a caretaker of somebody who has long COVID, but with the broader community. I don't think that's something that people who are not part of that community have been able to shake off. I think we're still living with that context. And I know that care isn't this sort of like binary on-off switch, but it does sometimes feel like that. And I think it actually has deeper implications for the context that we're in right now. I think that, shall I put this, that in a context in which the country is sort of sleepwalking into fascism, and that a lot of people are accepting pacification in this moment, and perhaps denying that what's happening to others could happen to them, that there are parallels to the experience of COVID and long COVID, and that also there are experiences similar to mask wearing as well that are related to this. For example, the fact that according to certain polls by reputable sources like Ipsos or Pew, that over the last few years that they've discovered that many Americans would, in some cases, prefer to have mask-required spaces such as grocery stores or hospitals, things like that, in spaces in which they don't themselves currently mask. And to me, what that says is that people would feel more comfortable if other people masked first, if other people created a context for that. And to me, that also is particularly relevant in a context in which perhaps in 2025, wearing a mask seems to be perhaps the most comprehensive symbol of nonconformity within society. And it's because it's one of the reasons I think why it's become such a target in the current world that we're in. That it's become a political target. It says more than just I intend to protect myself and my community, things like that. So I think oftentimes now in 2025 we're dealing with a context where that care has been layered on with other things, people's independent trauma from 2020 and people's political persuasions and things like that. But just to come full circle and everything, thank you so much for creating this context for reflection on that.
Thank you. I mean, when I said a philosophical question, I didn't expect so comprehensive a philosophical answer. But what I love about your answer is you take it from the interpersonal all the way to the political. And I keep thinking about it feels like we've just been this gaping chasm in the backyard, and ever since the pandemic receded or vaccination went widespread, we've been sort of pulling a tarp up over a hole in the backyard and pretending like it's not there. Or maybe to put it in terms that during the height of the pandemic, when it was all interconnected, both our care for other people and our ability to see inequities and disparities that were all around us before the pandemic, but the pandemic rendered visible, not caring for people now is also an act of unseeing what we saw, which is, I think you're right, it's about the sort of existential reality of I'm implicated in people's suffering. I was implicated in it before the pandemic, and now I can either choose to acknowledge what I saw, or I can pull the tarp up over it in the backyard, pretend like it was never there. And I really, you made me think, and I'm sure I'll continue to think later tonight about all the levels that you connected with your comment. There's a hand back here, sir. I think you might have lit him up because he responded at some point. So if you're going to speak to him, go right ahead. But go.
Well, I wouldn't speak to him, but I wouldn't be so bold. So my name is Gordon Skinner. I would say, in answer to your question,
Yeah.
it's a combination of both compassion fatigue
Yeah.
and cognitive dissonance. And that actually hinges on the more historical, which is in 2001, immediately after the towers collapsed, there were notices that were put up throughout the city, all in Spanish, and it was put in areas like East New York and Bushwick, saying that it is your civic responsibility to come down to ground zero and help clean up. It was anticipated it was going to take 2 years to actually clean up. It was actually done in 6 months. But individuals there weren't provided with personal protective equipment. And individuals then started having the early onsets of various cancers. But the medical community, writ large, was in collusion, for lack of a better expression, with the government. And they said that anyone who suffered from mesothelioma, or anybody who suffered something that was not respiratory, had to have a pre-existing condition. 99% of the rescue dogs down at Ground Zero died of cancer. Certainly not all of them had a pre-existing condition. They then established a through line saying that the plume, which actually went from Ground Zero to Bangor, Maine, upward projection, downward projection went to Cleveland, Ohio, 1,500 miles long, 50 miles wide. I forgot what the opacity is. And they now said that the catchment, or the line where stops, was either Houston and Essex, which in and of itself, no brains, no headaches, right? It's absurd to even think that this stopped here. But my point is that when we're looking at, if you want to know where you are, look at the causes that you made to get there. If you want to know where you're going, look at what you're doing right now. And yet again, we are looking at the most vulnerable in our society as billing opportunities. What does it say about the Hippocratic Oath? What does it say about us as societies? What does it say about me? And it's not about just being culpable, it's about being cognizant that individuals have been targeted yet again. And so I think that this is a great opportunity. The reading, the actors were excellent, the direction was great. It's now, but seriously, now how do we use this as a vehicle to have these very poignant and challenging conversations about where are we, how did we get there, and where are we going now?
Oh, thank you so much. I appreciate that. And that is, I think, when I said the wisdom of the audience, the collective wisdom of the consciousness in the room, that we need to hear each other's perspectives to become awake. And I see a hand over here, but I know someone has a mic over here, so we'll come back over here. Yes.
How you doing? My name is Thomas Haynes. I'm the guys with the green shirt. I'm the executive director of this organization, TMK. We work out in East New York and Brownsville with the man right there just spoke on. And, out in East New York, to us, in Brownsville, it wasn't never really a concern or a care. I was working around in COVID time, and a lot that was happening was devastating the homes, people not being able to see, go to the hospitals. They're not being spoke to, in a care and concern way. They just like, well, you can't see your family member and this is that. And, some of them are dying. It was like 6 to 7 people that was allowed to go to funerals. So a lot of people, what happened was they got desensitized, right? Because, when you have so much harsh treatment coming to you, now you yourself have to, act a certain or become a certain type of way, so you don't actually feel the things from the world coming to you. So in these communities, like the young man spoke over there about the mask. The mask was a double whammy from us, because we from a marginalized community, right? And the mask, we from poverty, first of all, right? So now, this was a time when this has struck, when these masses was war. Now this was a time for people of poverty. What happens when you're in poverty-stricken communities? And it's a time now that people are running around with masks, right? And this is something that America was hiding because, you know, they was just screaming, wear the mask, wear the mask. But people was having home invasions with people wearing the mask. People was knocking and catching you in the middle of the street and you not knowing who, you know, it was a sad thing because it was the violence, and that's the work that we do. We do violence prevention work. And it was also the health, a lot to deal with the health. It was like I said, it was a lot. It was a lot. A lot of homes had really been struck. You know, even myself, I lost my grandfather, and the thing was this, like, he was an older man, you know, and he lived to be 80 something years old, but at the time he was in a nursing home, and we couldn't even go see him in the nursing home. So all of that is devastating to the mind and stuff. So now I'm out in the street doing therapeutic services with people that's in this mindset, and then I have to deal with it myself. So when you ask about the care and concern, that's like far-fetched in certain communities and stuff. So
I really appreciate that, you complicating the conversation with bringing your perspective and your story into the room, bringing East New York, Brownsville into the room. That's why we wanted to make sure that East New York and Brownsville are represented in the conversation, because we've had people say, my father was a physician and I can't access the care I need. And we've had people say, I come from communities where wearing a mask can mean many things, and it can cause many things to happen. And layering it on top of this question of the very symbol for cause and care being something that can be weaponized. The complexity of that is something I appreciate. I want to sit with that and let people respond to it as well. There's a hand right here whom I know is a clinician, because I invited him here, so full disclosure. But I wanted to hear from a clinician in the room about this question, not just because we're talking about interpersonally to a certain extent, like our care for each other, but what about the healthcare system that Rebecca is talking about? She says at the end of the article, do I get upset about every individual hypocrisy I see around me? No, I let it go. But I'm sad that our concern for others is outweighed by the indifference of our healthcare system. And so I appreciate you being having the temerity as a clinician to take the mic.
Hi,
where did it all go? Where did the concern go?
Hi, everybody. I'm Dr. Alex Carvalho. I work at Einstein Montefiore in the Bronx, and it's a pleasure to serve the community, and thank you all for being here. It means a lot. First, I think a lot of what resonated with me was how, long COVID really affects people at their prime of their labor years. It's really, it's like a bell-shaped curve. And it's worse when people are at the best of their careers. So it affects families. It affects their productivity. Some folks really can't leave their homes. About the, disappearance of empathy and care, this is a very complex question. And I feel that a lot of it is the challenge of diagnose, number one. Like long COVID has a bunch of different manifestations. And there's different understandings and different definitions of what long COVID is, even between people that are researching it as we speak. So it's hard to grasp it. And then even harder, without the research that Brian mentioned, is to find a treatment for it. As physicians, we are, we're trained to help, to heal, to comfort, and often with long COVID, we don't diagnose. It's hard to diagnose, and second, we don't know what to do, other than symptomatic care. We definitely need more research, not less research. And something that is very clear to me is that vaccinations actually are proved to prevent long COVID, and this is also being shut down. So.
Thank you. Thank you for having the temerity to take on the question. What I hear you saying to a certain extent also is it's not compassion fatigue on the part of doctors, but I've seen this with other diseases, whether it's alcohol and substance abuse or it's other forms of chronic disease where there may not be an obvious cure. The primary care physician or the person on the front line who has 10 minutes to see a patient doesn't know how to treat. And so there may be, I'm just putting words in your mouth, but there may be an impulse or a bias against actually dealing with what may be in the room. That it's similar to some of the biases we've been talking about here in the room as well. I want to, there's so much more you brought up, the mystery of long COVID, the challenges, we're just crawling up out of the sludge and figuring out what it is, and that clinicians in your field all have different definitions of what it is, to further complicate the conversation. I promise you we're going to come back to the room here. I know there were some hands up, but we have a very large audience on Zoom, and it's kind of like a call-in show tonight because we have a much larger audience out in the world, and I want to make sure we honor the fact that we lit up the board with some of the things that have been said so far. So Tanya, I don't know if you want to respond to this question of, what resonated with you, or where did all the care and concern go? Tanya, what did you want to speak to tonight?
Thank you so much. My name is Tanya Taylor Powers. I'm originally from New York City. I now live in South Florida. I am a former professional actress, part of Actors Equity Association, part of SAG-AFTRA, and I am now on honorable withdrawal because I do have long COVID. I am mostly bedridden, mostly housebound, and my professional acting memberships, which I worked my entire life for since childhood, is now on honorable withdrawal. For more about my personal story, you can go to the World Health Network, look up my name, Tanya Powers, long COVID. That's my personal story. What I want to address is the question tonight. So I really appreciate, first, thank you for putting this on, to the theater company for organizing this, for the actors for participating, for the audience members, and kudos to all of my fellow COVID conscious and air quality aware people who masked. So I'm very thankful for Rebecca for writing the piece in The Atlantic, because The Atlantic has been very dismissive and very minimizing of both COVID and long COVID. I really felt with both the writing and the actor's portrayal, the emotional content of every single heartbreak that Rebecca felt. And it was portrayed tonight wonderfully by all the actors involved. And also, I just wanted to give a shout out. I'm a huge fan of Lou Diamond Phillips, so thank you so much for being part of this. I've been a fan since La Bamba. Back to what we're talking about. COVID is caused, it's airborne. COVID causes long COVID. That was the missing piece. During the pandemic is still now. That was the wording that I needed to address. So here's the solution. I come to you all tonight with hope, and to give some information that was a missing piece, that I thought everything that was discussed was wonderful. All the questions raised and the dialogue has been great, but here's what's missing. COVID is airborne, and it's what causes long COVID. There is a book by Carl Zimmer, if you can see this, called Airborne. If you haven't read the book yet, Airborne by Carl Zimmer, I recommend it. If you cannot afford the book, listen to his podcast. That being said, there's non-pharmaceutical solutions to clean the air. If you can see my shirt, I wear these shirts everywhere. Clean the air. You can get shirts that are like billboards from Redbubble, Clean the Air. And what can we do to clean the air? UL certified far UVC light, 222 nanometers. If you listen to any talks of Dr. David Brenner from Columbia University in New York City, he's one of the world leading people who is leading the research on far UVC light. Our Department of Defense in the United States has UL certified far UVC light. Biden's White House had far UVC light as he minimized the pandemic. And we also learned that the World Economic Forum in Davos, Switzerland also had UL certified far UVC light, as well as HEPA filters, which is what the hashtag Davos Safe meant. So going forward, what we need to see from theater companies, all indoor public spaces, all public transportation, is that the US EPA regulates clean indoor air quality. There used to be grants at the EPA under the Biden administration. For schools, they were called ESSER grants. All those grants expired. Theater companies can absolutely reach out to the US EPA, as well as members who are members of Actors Equity Association, members of SAG, I see people here from the FDNY, EMS. If you are a union member, you can rally your union and have your union labor rights people speak up to the union organizers and demand clean indoor air quality, both for yourself as workers, because this is a workers' rights issue, as well as whoever it is you are serving. And whether that's serving audience members, patients, or customers, You are providing a service. So we must have clean indoor air quality to continue to get out of this pandemic, because it's not just COVID causing long COVID. We have tuberculosis outbreaks right now that's airborne. We have measles outbreaks that are airborne. And I am absolutely a person who is pro-vaccine. I think that Louis Pasteur vindicated Ignaz Semmelweis and his work. But here's the thing. We do not have effective vaccines. I was fully vaccinated. I was fully boosted before I got long COVID. And I received my COVID infection that caused long COVID, seeking healthcare as a lone masker, getting eyeglasses in Target Optical. The infection went into my eyes and almost made me blind. And the other missing piece is that because people can't work like myself, depending on the state that you're in and access to healthcare, whether you have access to, I haven't had any access to Medicaid. I've had a pending disability case for over a year. I'm living on SNAP, which may be denied, and I've been denied access to Medicaid. I personally live with my father, who's 85 years old, and that's how I have a roof over my head right now. People who do not have that, there are many of my friends who have long COVID who are living out of their cars right now, who were denied disability rights. Some of them had to go back to work. Some of them are living in their cars. Some of them are living in tents. Some of them are living in shelters and got reinfected with COVID again after getting long COVID. And we need to share their stories as well. So that being said, going forward, please, until we get universal far UVC light and clean indoor air with UVC and HVAC plus MERV filters in every single public indoor space mandated, the same way carbon monoxide detectors are mandated, please continue to wear a respirator. There's Omni masks, which are see-through and clear if you're worried about security reasons, and do everything that you can to advocate intersectionally. I thank you for your time and listening. I love you. Be safe, be well, and thank you so much.
Thank you so much, Tanya. I appreciate everything you brought into the room. Thank you for your advocacy. It's powerful to hear you as a member of our profession speaking from such a personal place, so vulnerably about your own journey and struggle, just like Rebecca did, speaking as a journalist. Thank you so much. I'm going to ask that people moving forward on Zoom especially, I know this is a very charged topic and people really want to share a lot, but we have a lot of people we want to get to in the room here, and we have a limited amount of time left. So I'm going to ask people to try to keep their comments to a relatively short period of time, and because I want to get to, there's a lot of people on Zoom and a lot of people in the room that we'd like to get to still. Miranda, you've been, Jamie, you're next. Which are the questions you want to respond to? What spoke to you? Where did all the concern go?
Pretty big coincidence. I'm also a SAG-AFTRA actor. That my career is also on hold. But one thing that resonated with me the most, wonderful work by the actors and the performance and everything in the article. My brain fog hits me in the face pretty hard sometimes, so I can't always be as loquacious as I would like to be. That's my new favorite word. What really spoke to me is and I'm sorry I forget everybody's name, the physician who spoke earlier talking about people whose careers and lives are being taken away from them at their peaks. My career was blowing up. I'm 37 years old. I was getting ready to buy a house. I was auditioning, I was booking, I was working. I live in Atlanta, by the way. And I moved all the way out here from Los Angeles. That's the cool thing to do for actors nowadays. But that's the problem with that. And another thing that spoke to me with that is the isolation and nobody really being there for you. Because one of the problems and my own personal story, and I'll try to keep it to a minimum, is my family all lives in Oakland, California as well. Shout out to Ezra from earlier, Oakland represent. But it's just been, it's hard to put into words how it's like watching the world go by without you is the most humbling but most heart-wrenching thing I think anybody could possibly experience. It's like being the living death or living death. It's like, this is what the world is like without you living in it.
But that's such a poignant thing to have said, and I appreciate everything you brought into the room about your own story and where it hit you as you are moving in your career and where you are now. I think it's such an important thing to have echo in the room. And I'm sorry to have to cut you off, but I want to get to some more people. And I can tell that people really want to share their stories. And I wish we had hours and hours and hours. The first time we did one of these Theater of War events, we had a conversation afterwards that we scheduled for 45 minutes. It lasted 3.5 hours and it had to be cut off at midnight. And we're not going to do that tonight. But I know that we could. This could be an endurance event because there's so many stories that need to be heard. Thank you, Jamie, for sharing some of yours. Miranda, over to you. What did you want to speak to tonight?
Hi, thank you. I will try to keep it short. My name is Miranda DeNovo. I have long COVID and ME/CFS, the other illness that was mentioned before. And I'm also a caregiver for somebody with very severe long COVID, who I've been caring for about a year after they became homeless due to their illness and a larger, more complex situation. I'm so grateful to Tanya for raising the homelessness issue, because usually even in conversations about long COVID, I'm like the only one saying like this disease is making people homeless. And it's also forcing young people into nursing homes and forcing people to stay in domestic violence situations if they don't have access to any other care. We're so lucky here in New York, at least with access to Medicaid. And if you do have access to Medicaid, that gives you access to home care. But if you don't have home care and you can't perform your own activities of daily living, then often you have no choice but to either stay in unsafe situations or to go into a nursing home. I have spent a lot of time over the past year, just hours and hours and hours, calling homeless services organizations. And that's the part of Rebecca Nagle's piece that resonated with me the most, was just the endless phone calls and the endless phone calls to people who have no idea what they're talking about, or who will pass you to someone else who will tell you a contradictory thing, or who will refer you around in circles. I called, I think, probably 20 homelessness nonprofits, including some that are specifically for disabled people. And every single one of them told me that my friend was, quote unquote, not suitable for shelter because they could not perform their own activities of daily living. And when I said, what are the alternatives to that? They said nursing home, even though we had a whole independent living movement designed to prevent that. So that's the main thing that I wanted to say. I guess the other thing I was going to say is just, where did the care go? I mean, it's still here, but it's invisibilized, and it's because it's sick people caring for each other. I am too sick to be doing this work. I should have somebody caring for me. And instead, and everybody who's cared for me is sick. We are all sick people caring for each other in the circle, the same way mutual aid is a bunch of queers passing around the same $20, And everything that you've heard from all the people here today, take that and compound it with, if you are poor, if you are trans, if you are Black, etc. On the masking front, especially, somebody did research saying that basically, like, when it was clear that the pandemic was disproportionately affecting Black people, that's when people stopped masking. Anyway, it's just brutal. Thank you to the people from East New York who were here, and thank you to the person with the 9/11 history. I thought that I didn't know any of that, and it just makes so much sense with what I've experienced as well. So
Thank you for being with us. Thank you for everything you shared. Thank you for being so present in your telling of it. I'm going to ask you all to bear with me because this is a radio show and we have to take a break in the discussion. We're going to come to Hawk next in just a moment, but I'm going to switch over here just for 1 second and say, I'm Brian Dories, and this is Theater of War Productions presented by WNYC, where we perform a piece of journalism and then we talk about it. Stay with us. I'm Brian Dories, and you're listening to a live performance of Theater of War Productions presented by WNYC. We just listened to an article from The Atlantic about the difficult realities of navigating the healthcare system from the inside. It's a story about long COVID from a woman who's been dealing with the virus and its aftermath for over a year. Rebecca Nagle is Cherokee. She's also a writer and reporter. Her story describes the gaps she encountered in the healthcare system: closed clinics, unanswered phones, treatment plans that didn't treat her symptoms. At Theater of War Productions, we always invite people with something at stake to our events. Here in New York, our audience is filled with health advocates and doctors and people navigating the healthcare system. We also have Native Americans and long COVID patients, including some of the very people Rebecca interviewed while reporting her article, all joining us from all over the country by Zoom. Hawk, you're next. You've been waiting for some time. What resonated with you? What spoke to you? What touched you? Or where did all the concern go?
Thank you to the actors for speaking on this topic and performing so beautifully, and to this author for writing about this. I wanted to speak to this as a person who was chronically ill before the pandemic and will be chronically ill after the pandemic. The point that I wanted to make was that the disabled community existed before COVID and will continue to exist after COVID. And attention was brought to this community because what we called TABs, or temporarily able-bodied people, were suddenly threatened by a pandemic. And I was also working at one of the biggest hospitals here in Seattle in 2021 in the administration portion of the hospital. And when you were talking about and questioning sort of what was going on with hospitals, where did the care go? Our system is fundamentally shattered, absolutely shattered. I worked in that position for less than 6 months. As a disabled person who knows from the outside looking in how bad it is to make the phone calls, I could not be the person on the phone going, yes, I know we just opened that long COVID clinic. I know it's been less than 4 weeks. They have a wait list. The wait list is 6 months. I'm sorry. I know it's one of the first 5 in the nation. There's nothing I can do. I'm sorry. I know that you are dealing with debilitating symptoms. I'm sorry. There's nothing I can do. The system is absolutely shattered, and it's shattered because all of it is falling on the bottom tiers, and there's nothing coming down from the top to reinforce. So it was really, really hard to work that position and to see it from the perspective of someone who was disabled, who already knew that the care was shattered, and then to go on the inside and realize that the nurses are exhausted, the doctors are exhausted, they're recovering from a pandemic where they aren't getting support. And as Miranda just noted, we are sick people taking care of sick people because the healthy people don't have the ability to take care of the sick anymore because there's not enough support in our system. So if you are currently a temporarily able-bodied person and you think that your health is going to be with you for a long time, I would encourage you to consider what it's going to be like when it's not there, because everybody exists in a state of temporary able-bodiedness. And at some point in your life, you will be disabled and you will be suffering, like everybody on this panel is talking about. And you're going to need support. And the way our government and our systems are set up right now, they don't provide it.
Thank you so much, Hawk. I really appreciate everything you brought into the room. It's a good segue to another question I want to ask the audience. I want to come back to the room here. We've got some people waiting on Zoom. We've got about 15 minutes till the end of our time together. So I ask everyone to be conscious of the fact that we have 15 minutes to get through a lot of people. But I want to ask this question because it was raised earlier. Someone raised it when he talked about the antelope and the herd. And I was really struck by that line in Rebecca's piece. This piece that spoke to me as I heard it read tonight was, I feel like the wounded antelope picked off from the herd. And we've heard so many people now speaking about isolation, about feeling uncared for, that they are only able to rely upon other sick people for their care. But as a society, can we just accept a future in which we leave our wounded behind to suffer and sometimes die? And this is a question where I'm sort of asking a larger philosophical question, not just about interpersonally, but also in terms of our healthcare system and where we invest. As a society, as a culture, as a community, how do we move past our own indifference? How do we move others past their indifference as well? And you've been waiting for some time, and you can answer that question, you can weave it all into one perfect statement, whatever you'd like, but I want to come to you. Yeah.
My name is Star Kim. I just returned back to society after serving 25 years in prison. I've only been home for 7 months, and one thing that I felt compelled to speak about was the fact that you have a large prison population, right, who were isolated during COVID, and we understood that we had long COVID way before society recognized the term, right? We were in there training, right? And during our training, we realized that we couldn't train no more like we used to, right? COVID had worked a number on us. We had COVID at a point where people didn't recognize what it was. They didn't know what it was. We had it. We were inside. Then when they isolated us and they stopped us from receiving visits, the officers was allowed to come in and out of the prisons. Then all of a sudden there was an uptick in COVID cases. We had the lowest COVID cases in New York State prisons. Eastern Correctional Facility had the lowest COVID cases in all New York State prisons. And then all of a sudden, out of nowhere, all of the cases started rising. It started being an uptick in cases inside the facility because it was an indifference by the administration that enabled officers to come into the prison and bring COVID and introduce it to the population. And it seemed like it was deliberate. And that's something that I felt compelled to speak about because we're having a discussion about COVID and we're ignoring the prison population. America has the largest prison population in the world, and we're not including them in this conversation, and that's imperative.
Thank you so much for sharing your story. I'm so glad you're here, and I really appreciate you. The line about being an antelope cut off from the herd takes on even new levels of significance when thinking about the population of people who were incarcerated when the pandemic began, who weren't necessarily being protected, and as you say, may have been exposed in many ways unsafely to the pandemics in ways that are still affecting people to this day. So I appreciate you bringing you and all the people you were inside with into this room with your comment. Yeah, there's a hand over here. Yeah, right ahead. Go right ahead.
Hey, how you doing? My name is Mr. Washington. I represent Taylor Made for a King. And it's just like the follow through what some of my brothers and colleagues was talking about as far as with COVID. I'm formally incarcerated too. I received a sentence to 12 years to life at the age of 15. And I came home in 2023, June 27th. You know, and I was incarcerated when COVID hit. In 2020, I was incarcerated. I was in Sing Sing Correctional Facility for that. Yes, I remember. And I had caught COVID when I was around like 2022, when I was in Auburn. And I remember me being isolated for 15 days and not having no symptoms. You know what I mean? But people was coming up there. It was a lot of games being played with the COVID. Wow. Well, you know, with people that was incarcerated, our families, the visits, and to be truthful, it was coming from officers. Officers is the ones that was coming through. They had immediate access to outside. You know, people are civilians, and they wasn't protecting themselves. We was at risk up there while we was incarcerated. Those people that's was working on reintegration. You know, so like some of my brothers was talking about, that was a heavy issue out there for people that was locked up in New York State. And I think a solution to that would be, as what you're doing right now with this type of setting, is getting people together and trying to figure out a solution to the next step.
Thank you so much. I really appreciate that. There's a hand in the middle over here, and then we're going to go back to Zoom for. And it just was a hand somebody here. Go ahead. Go ahead while the mic's coming over here. Yeah.
Hi. So I'm a physician in New York City.
Excellent.
And, you know, I think it's important for us to recognize that in healthcare, there is a very extensive history of abuse and maltreatment. And it's important for us to recognize that that has happened and that that is horrible and that it is still happening, I think, in lots of ways. And I think, again, to the point that the last two gentlemen brought out, that there are marginalized people in our society that we're not looking out for, that we're not helping access care, that we're not supporting, that we're not meeting the needs of. And that, I think, again, is a point that, you know, we need to build these systems and these structures that allow us to do that.
Thank you so much. It's really powerful hearing from a physician in response to some of the things that have been brought up in the room. I appreciate you acknowledging what some of the individuals have said so far about the experience of being incarcerated and encountering the pandemic and feeling like sitting ducks. You know, I hear so many different people who've spoken during this conversation tonight speaking about that feeling of isolation, of feeling not uncared for, of feeling marginalized. And it's not a competition who's most marginalized. It's an acknowledgement that there are experiences that we share and that there are ways to acknowledge each other's suffering, and there are ways to come together to build systems to address it all, but not leaving anyone behind. This question of the antelope is leaving someone behind. Can we as a culture live with leaving people behind, whether they've been incarcerated or whether they're fathers or physicians? You've had a hand over here for some time. Yeah, go right ahead.
Yeah. Well, I actually worked at a psychiatric facility, a locked psychiatric facility with about 300 people in there. And during the pandemic, I, as a person who was not part of the immediate staff, I couldn't visit people. And people were in, basically what happened in that facility is that people were like in a place where they had to stay in the room like almost 20 hours a day. They couldn't, they ate in the room, they stayed in the room during the pandemic. They didn't have access outside people they didn't have visitors to come in. And at some point, they eventually started to have masking and stuff, but not all the staff masks. And like they mentioned, if staffs come in the facility that's sealed, and the people there don't have any diseases, they come in with COVID, they got COVID. We had COVID wards, we had people, were getting COVID, some people died. And also there was an issue with the staff who didn't want to have the vaccines when they were there, even nurses, like, oh, we don't want to have the vaccines. So we had the issue of people coming in and not masking or not enforcing, the policy, or not every the patients getting access to vaccines and stuff. So that was an issue for those kind of folks who are dealing with that. Kind of mirroring the who's locked up, I guess, and that kind of deal. The other issue I wanted to bring up was that there's a common idea which people kind of take for granted. It's called just world theory, meaning that people feel like the good people don't get sick, and the bad people, they get sick. So I'm one of the good people. I'm doing the right thing. I'm rich. I'm famous. Whatever it is, I'm not gonna get sick. And the people who are sick, they kind of deserve it. So I just don't really think I'm part of that.
Thank you for surfacing that idea, that sort of prosperity politics idea, the idea that those who are marginalized deserve it, those who are sick deserve it. It's a hard thing to hear someone say, but when you're talking about people incarcerated, people in psychiatric facilities, it really hits home. So thank you so much. I know your hand is up in the back, but we have a few people on Zoom I want to get to. Sarah, you've been waiting for some time. I know you're audio only, but Sarah, I don't know if you want to speak to any of the questions that have been raised or all of them at once, but thanks for your patience. Over to you.
Yeah, hi. My name is Sarah. I really just want to talk about access to care, and specialty care for Indigenous folks. I'm Navajo and an enrolled member of the Turtle Mountain Band of Chippewa, and I live in Oklahoma City. I'm a reporter for an NPR member station here called KOSU. And hearing Rebecca's experience with the largest outpatient facility of any tribe is alarming to me, but it's not surprising. The IHS has a history of chronic underfunding and remains underfunded today. In a recent budget request made by tribal leaders around the country, they proposed a $73 billion budget for the IHS, which is 10 times higher than the current funding level. And here in the state, more than a fifth of Indigenous Oklahomans are uninsured, which limits their access to healthcare even more. So this piece just makes me think of those folks who had long COVID, who rely on the IHS as their only form of healthcare. And hearing Rebecca's reporting that nowhere in the IHS is there a long COVID clinic, it makes me wonder how many natives are falling through the cracks and unable to get care. And my heart just goes out to them. So that's what I wanted to share. Thank you for having this event. Thank you, Rebecca, for sharing your story, and the actors who participated, and for everyone who's shared their own experiences.
Sarah, thank you for what you just shared and for recentering the conversation for a moment back on care for Native Americans, lack of access, that startling statistic in Rebecca's piece that there are no long COVID clinics in the entire Indian Health Service. Rebecca, I think, is with us, and usually we have the author in the room. Rebecca's in Oklahoma, and also, as you know, had long COVID, so she couldn't be with us here, but I'm so delighted that she raised her hand. Rebecca, we're going to go over to you. What did you want to speak to and what you've heard tonight?
I just wanted to say thank you to everyone who came to listen to the piece. I think obviously one of the things that I talked about in the article was how alone I felt and how separated. I mean, when you're sick, there's sort of this chasm between like the world of the well and the world of the sick. But having everyone listen to the piece and give their input has been like really powerful for me, like personally tonight. I just also wanted to say that I think the thing that helped me get through it while I experienced a lot of frustration and sort of just ridiculous level of indifference from the healthcare system with the family and friends that supported me. And so, yeah, I just want to say thank you to them. But thank you everyone so much for being part of this. It's just been really powerful to be able to listen tonight.
Thank you so much, Rebecca, for letting us do this. Thank you for your piece. Thank you for sharing your story with us and helping others engage with it. There's a couple more people I want to get to in Zoom, then we'll get to one last person here in the audience, and then we'll continue talking informally afterwards. But Kathleen, you've been waiting for some time. What spoke to you? What did you want to speak to tonight?
Thank you so much. And thank you again to Rebecca for writing this piece and the actors tonight. This has just been really amazing to see. I am a long COVID patient. I'm also a health systems researcher. Just wanted to point out that a lot of those people who have been able to access healthcare are able to do so because it is an extreme privilege to be able to do so, not just geographically, but also financially. It can cost tens of thousands of dollars out of pocket, outside of health insurance costs, just to have the basic needs met, especially if you are not able to leave your bed, in order to just get your sheets changed on your bed, or be able to get your groceries delivered to your house, or even being able to get on in a ride share, just going to your healthcare office. So I think that is often lost in the conversation when we're talking about healthcare access and all of the external things, not specifically within the health system, that it costs just to get in the door.
Thank you so much. I really appreciate you bringing that perspective into the room, refocusing us on inequities on socioeconomic levels with regard to access to care, and not just care, but basic needs for people who are struggling with long COVID and also other forms of chronic illness. Danielle, I think you might have to be our last person on Zoom. I apologize for those who are with us, but even nodding your heads along has been a contribution to the conversation. But Danielle, briefly, because we're almost out of time, what did you want to speak to tonight?
Really quickly, I'm a nurse. I got COVID back in 2020, and I think survivorship bias is the major thing that it's the major hurdle that we all have to overcome. A few things I want to share with people is, there's a few books called Revolutionary Medicine about our founding fathers and how the role of vaccination allowed us to win the Revolutionary War. But in this book, you hear letters written back and forth between all of our first founding fathers, like the 5 presidents, and how they lived their life again. Like, even if we never get access to care, there are primary principles of ancestral living that can help us restore or maintain the quality of life. I have been in this game, and I knew what was happening to me early on. I was accused of weaponizing my illness to divide my entire family. I have not spoken to anybody in my family since I've been ill. It has been a lonely, but because I was a pediatric oncology nurse and I advocated for children, for them to get access to care, to lobby in Washington, like, I know we need to get organized. We need to follow in the footsteps of people with HIV and AIDS. We really just need to learn how to get organized and have a strategy when we're approaching Washington and we're working with our healthcare providers to allow them to know how they can help us best.
Thank you so much. It's so powerful hearing that from a nurse. And I appreciate you acknowledging that even without care, there are things that we can hold on to, values, ancestral knowledge that are critical to the way forward. This question of how we move past our indifference, how we move others who may be indifferent or might have survivor bias, as you mentioned before, is something I'm sort of still struggling with and thinking about as we wrap up our time together. So I wonder if there's one last person here in the audience who hasn't spoken, who had something burning with them to say. There's an individual right here who had his hand. I saw his hand. Yeah, we'll go over here. Who, no pressure to sum everything up into one perfect statement.
How about if I bring it full circle?
Go ahead. Yeah, that's
okay.
Great.
Because something this gentleman said and someone over there said about being incarcerated and being sort of an isolated community. We started with indigenous people reading the script, and that's really, we saw that when the colonizers came to this country, and 50, 60 million indigenous people died, some by gunfire, some by other horrific means, but many of them died through the diseases brought and shared with the indigenous population, many millions of people, and maybe it's not just in the US of A, but all throughout this continent. And the EMS worker said something about there not being lions. I'd say there's a lot of liars, though. And there are lying, there's a lot of lying going on about things. And I would also say, I think you started by saying how the healthcare system serves. I think what we've learned is it doesn't serve very much. It serves very poorly. And as I've had to say to my own physicians, you're not practicing medicine, you're malpracticing medicine by asking me to wait months to see somebody that one of your colleagues told me I needed to see. And we make a lot of fun about other countries' healthcare systems, that they're substandard. Well, I think we all need to just take a really close look in the mirror, start there.
That's a really, I think, powerful and uncomfortable place to end the conversation, but I like it. As you say, coming full circle, the relationship between pestilence and disease and the native populations that our colonizers displaced and killed. On a day that on the front page of the New York Times, top of the fold, is a story about new guidelines regarding vaccine mandates for children and pregnant women. And a day that I was told as we walked into the room is also the anniversary of the Trail of Tears. Synchronicities abound in this conversation. Connections across the room are being made across people from totally disparate experiences, different forms of isolation. And yet we come full circle to this last comment, which isn't meant to put a bow on the conversation or tie it, but just to remember where we are and who we are and what our responsibility is, and why this story in particular was so powerful, being read by this particular group of actors here in this space in New York City tonight. I'm grateful to everyone who participated in this conversation. After an early performance of one of our projects, someone answered the question, why did the author write the text? And the answer that came back, that became our motto, was to comfort the afflicted and to afflict the comfortable. And we hope we did a little of that for everyone here tonight. It's good if we're feeling uncomfortable. It's also good if we're feeling connected, and that maybe that lifts some of the affliction as well. There's so many people who joined us. I know some who were in their beds. We've had people since we started doing work on Zoom who were bedridden, participating in conversations, whether they had long COVID or not. How powerful it is to hear from people directly from their beds, from their homes, when they wouldn't necessarily be able to be with us otherwise. How powerful it is to lift their stories out of isolation and platform them. I'm so grateful to Rebecca, to all of you for coming here, for being with us for the last hour and a half, for having this conversation. And you'll forgive me for reading the final credits as we close out our radio program for this evening, and hopefully I can get this right. You've been listening to Long COVID Showed Me the Bottom of American Healthcare from Theater of War Productions, presented by WNYC. Theater of War Productions is me, Brian Dories, and producers Marjolaine Goldsmith, Dominic DuPont, and Adam Isco. Rebecca Nagle wrote the story for The Atlantic. At WNYC, this was produced by Ryan Wild, Emily Botine, Katarina Barton, Jared Paul, Michael Kutchman, Jason Saul, and the entire team at the Green Space. That's Chase Kulpon, Robert McGinnis, James Cronier, Marika Hacking, Dalila Sala, and Eric Weber. We want to thank the Lori M. Tisch Illumination Fund, who made this production possible through their generous financial support. Thank you for listening. The conversation does not have to end here. We can continue talking outside in the hallway. I know Alex wanted to say something. Do you want to say something? Okay, as people are walking out, Alex wants to say something.
Hi, everybody. Because finding a clinic slot for long COVID patients is so difficult, as we saw from the piece, thank you guys. I would want to share a resource of our Monty Core Clinic, which is the COVID Recovery Clinic. I double-checked today, I promise, and we're open, and we don't have like a waiting list. So number is 844 844-556-6683. 844-556-6683. Extension 36, so you go straight to the gold. All right. It's going to be a pleasure to care for everybody. Thank you.
Thank you so much, Alex. Thank you. Really appreciate that. Thank you.